I've been asked to speak today from a patient perspective, which actually is not an easy thing to do when you consider the great variation in human beings, human physiology, the great array of conditions and chronic diseases that exist. Truly, I don't believe that there is a uniform patient perspective. However, I will attempt to speak on behalf of cardiovascular and cerebrovascular patients, which is an area that I do have some familiarity with. And if I'm lucky enough to get some of their perspective right, then hopefully some of the views and values will resonate with other patients and patient groups as well. One thing I want to also mention before I start is the Heart and Stroke Foundation does actually have a position statement on access to medicine. You can find that on our website on the homepage under Advocate. And my challenge today has been to boil down our 4-page position statement into 7 slides in a logical and appealing way that will hold your interest while keeping you on the edge of your seat, all within 5 minutes, plus or minus a minute. Right, Lillian? So here's trying. So the good news is that I'm not going to present you with an overwhelming array of statistics and facts. Instead, I've just taken a few from our position statement that highlight the significant demand for prescription medication, which is the first 3, while at the same time illustrating in the last 3 points that we have not totally fully met the needs of Canadians and that there are still many gaps, and within those gaps are individuals just like you and I that either have no coverage or not enough coverage in order to fully benefit from the advances of modern pharmaceutical drug treatment. And that is a tragic situation indeed, and it is not dissimilar to denying someone access to healthcare services, such as physician services and hospital services. Still, even more disconcerting is the fact that we continue to see dramatic increases in some chronic diseases, like diabetes, and conditions like Alzheimer's. And on top of that is our aging population, which is not exactly the picture of health in many cases these days. If this is not a wake-up call to get our collective house in order to develop a quality national pharmacare system, I don't know what is. Our position statement on access to medicine does not currently have an explicit vision within it. So as part of this panel, I attempted to tease out one, and here it is behind me. And really, aside from all the verbiage, it contains 3 primary elements: a requirement for an equitable and quality system of coverage, an appeal for a system that delivers true benefits and values while focusing on a sustainable system over time, and a statement of encouragement. And I know it's easier said than done, but we believe it can be done if certain goals are constantly kept front and center, goals that hopefully most patients will aspire to and would want to see in such a system of national drug coverage. So what are those goals and what would they look like? So being the compliant panelist I am, I next attempted to come up with the goals that would support a national pharmacare system. And they are, as you can see, and again, these goals were derived from our position statement, and as you can see, I've come up with 4. And what I'd like to do now is just briefly walk you through each of them and their key attributes. So starting in the top left corner is coverage, which is perhaps the most important goal of our vision. Some key attributes of coverage include, plain and simple, equitable coverage. No one should be without some form of coverage, and so we advocate for national uniform coverage, universal coverage. Catastrophic coverage, simply that, following on that of equitable coverage, is that no one should be out of pocket to the point of where their financial security is at risk. Access standards, which is really intended to mean that individuals should have access to some form of effective treatment in a timely fashion. In other words, we need to develop clear national access standards, complete with performance measures, while ensuring that we keep the red tape to a minimum. And lastly, payer network. And here we're not suggesting a one-payer system, but instead continue on with our current mixed model, perhaps engaging the federal government a bit more, especially on the funding front when it comes to the equitable coverage and catastrophic coverage, and ensure that this model forms an adequate network of coverage for all patients based on their individual circumstances. Next is the goal of choice. Accommodating. The bottom line is that individuals react differently to drugs for a whole host of reasons. For example, someone may respond well to an antihypertensive or cholesterol-lowering treatment, where others do not. The most important point here is that patients achieve their treatment goals. And if they don't, then they need to be able to move on quickly to the next treatment option that suits their individual requirements. Autonomous and related to the previous attribute of accommodating, we feel the best way to ensure individualized treatment and optimal patient outcome is to allow and trust the people directly charged with and trained in patient care to make the best decisions on behalf of their patients. However, these health professionals need to be adequately supported in doing so, and this will be a point I'll touch on briefly in my next slide, and I'm speeding along here. Variety, and following right along, in order to practice individual patient care, the drug formulary and dispensary must be well stocked with an array of effective therapeutic options in order to adequately respond to individual patient needs as the occasion demands. And lastly, flexibility. And this is basically what we're saying here, is that there needs to be a system that allows for easy graduation and movement from one medication to another, as the case may be. Here it is essential that red tape and bureaucracy be minimized in order to streamline and expedite treatment. Goal number 3, capacity. And this is really a foundational goal to support the goal of choice. Best practice evidence, which entails using various schemes to allow health professionals to easily assimilate and incorporate into clinical practice the most current information and recommendations for optimal pharmaceutical treatment, also known as appropriate prescribing. Self-efficacy and empowerment, which is allowing patients to be full and active partners in their pharmaceutical care in order to increase the odds at arriving at the best possible outcome. While this may not be an option for all patients, we can certainly do a better job than we currently are, and we believe this will go a long way to improving prescription compliance, achieving treatment goals, adverse event reporting, and so on. And lastly, quality assurance, putting into place a comprehensive and uniform national quality assurance program that provides for checks and balances necessary to deliver safe and effective pharmaceutical care. I'm going to get the hook here. So my last goal is that of quality. Just a few attributes related to that. Accountability. There's no denying it. We all have a role to play in preserving our own health, but also the preservation of the larger healthcare system. This is also the case when it comes to a national pharmaceutical system. We need to define our roles and responsibilities clearly and hold each other to account for honoring these in order to deliver a high quality and sustainable system. We all need to do our collective parts in order to be successful. Reasonable, entrenched positions and senses of entitlement are not part of a quality national pharmaceutical system. We have a number of tough issues to grapple with and a number of complex variables to weigh in and balance in order to have such a system. Let's let reasonability and common sense be prominent elements in our decision-making going forward, as they often get lost in the sea of positional and highly charged rhetoric. Affordability, possibly the toughest attribute of all to reconcile, but perhaps with a new sense of urgency and common interest in finding enduring solutions, we can arrive at affordable national system. And finally, sustainability. And this attribute is tied directly to the notion of affordability and implies a system that is both affordable and resilient over the long term. Again, like other attributes, the pursuit of sustainability has to come from the effective collaboration of stakeholder interests and a passionate commitment and belief that a viable and long-term solution can be found. And here's hoping. Thank you very much.